Hello, my name is Miguel Gomez, and I am a fellow Xray student, sophomore year. And I'm here to make a video to give you all insight of what you can expect, like during your first few days at clinicals. I know during that first day you're all nervous, you're shy, you don't know. I mean, you know the knowledge, like you know how to do all the exams and stuff, because like you learned during the first semester, or depending how you program some of them, you might have to wait till the second semester to know all of them. But in mine, they showed you how to do all the exams. And basically, you'll wear a uniform. In my program, we have a white scrub top. I mean, well, it's a white polo, and then just like some blue, just like some normal blue scrubs. That's what my program, because our school colors are blue. And you'll wear a dosimeter, which I don't have mine on, but it measures like the radiation you receive, and then you'll have your markers. So try to get there a little bit early, because sometimes it makes you like, because some hospitals are big or small depending on where you go. So you find your way to the X-ray department, and then be nice, introduce yourself, find your CI, and like try to always like clean. Like once you get there, try to clean, try to get more sheets like for the patients, try to see, try to do some things to try to help out, because basically the places you have clinicals are kind of a, you could say, job training, like job, like they can see how you work, so like when you graduate you can have a job, and like make it more easier because they already know what, like how you work and how you can do, so make it easier if you like if they're hiring so you can get a job. And then usually I would always go to the rooms, ask them to show me around, and go to the rooms, because different facilities will use different devices, which they're kind of the same, but some of them use automatic, like control, and then other ones you have manual collimate, other ones will use CR, and other ones will use DR. And I mean, there's different kind of machines. There's like Fuji, and then there's other kind of brands. They're kind of all similar, but so you can get a hang of how each works. Certain ones are like more harder to use than other ones, and then also like try to see what your portables, how those work out. I mean, for usually, especially during your first year, you'll be there with the tech, with usually your CI or the other techs around there, and then depending on how they see you work and do stuff, they'll allow you to like slowly progress to being more independent as X-ray tech. But during the first few days, like they'll be there right beside you, and like some of the students I've seen, like during the first exams, they'll just follow the X-ray text. They'll like see where they go, where certain rooms are, or the different departments like ICU, ER, different departments, and then also they'll like teach you the protocols of how certain departments, certain exams, their doctors like for instance, there's at the clinical side I'm at right now, like for a lumbar spine, they just want AP and lateral on the spot. And then right now I'm in a trauma rotation, and it's a different clinic, and they like to do their obliques. Some obliques they like, some clinic sites like their obliques anterior, other like them posterior. So you gotta always try to see the protocol list to see what they want, because depending on the doctors, certain they like them different. So you always got to be aware of that. And then always remember to mark your exams. I mean, if you don't, it'll be okay, but preferably certain X-ray techs will be more strict. So like if you try to, as it's called, comp you're an exam, which will later on you'll learn about that in proficiencies. They won't give you the signature that you performed the exam right if you don't have your marker on it, or if nothing's like clipped off. So depending on certain techs or CIs will be more strict than other ones. So watch out on that. I mean, what you could take basically, I took like just a simple backpack, and then I'll have like my comp sheets. I'll have like maybe a book. Some places allow you to do more homework. Like on some sites are like slow, so they'll allow you to do more schoolwork. Other ones they'll just you'll be so fast paced you won't have time to do anything. And you can bring like water or food, like your lunch and stuff. I know, especially right now with all this COVID stuff, certain facilities they don't even want you to bring anything because they don't have room. So sometimes just the bare minimum, depending. You'll learn more of this stuff that like as you learn more about your site. And then certain sites they have more fluoro, and other ones don't have any fluoro at all, and it's like straight only X-rays. So especially in my school, when you're on a fluoro site, try to do as much BEs, UGIs, upper GIs, cystos. Try to do the most type of fluoro you can, and then try like our teacher always told us, like when you're in there, like try to be the first one to go get the exam. Try to initiate. Try to show that you're willing to do stuff. And also makes you look good. I mean, yes, there's some times where there's nothing, and then we'll just be there, sitting there. You can't do anything. And then with phones and stuff, you're not supposed to bring them because like you'll get in trouble, and they don't want. How certain hospitals are more like really strict about that. If they see your phone or if you take a picture of anything at all, like it caused one of our former students to get expelled from the program. So sometimes it is very serious. And also with like your uniform and stuff, your school doesn't want you to take pictures. So that's why I'm like not showing you my full uniform because you could get in trouble for that. They don't want that. That's why like on video I'm like covering it up just for safety purposes. But yeah, I mean you'll see some cool stuff. I've been on my third site right now, which is it's just a normal X-ray. But before that, I was in a fluoro hospital, and I've seen some BEs. You'll see a lot. Most of the time, it is more older patients that will perform a lot of X-rays, a lot of chest, a lot of portable chest, and then let's see what else. And then there's some, depending on there's different departments you'll go into. Like you'll be in the ER, other ones you'll be in the main department. One's called over here the POB, which is kind of your walkie-talkie patients. Some of them are like pretty easy, just a normal X-rays, which it's not a problem. You can do those all day. And then I've seen some places they'll like need you to do the the monitor their like take basic like vital signs, I guess you could say, like because you do pre-op, so that's before surgery. So like you'll have them get on the table and do like an EKG to like do a heart rhythm. I've seen other places where we had to do like check their O stat, check like do basic things for patient care. And then that's another big thing. Try to always do the most for patient care because my lady's a nurse, and like sometimes she tells us like the nurses they have way more stuff than we do, and they'll always be busy. So like she's always like, Miguel, when you can, try to help out, try to patient care because like even I remember being one time being sick and going to the clinic, and like sometimes it's really cold, and a lot of the elderly people they don't like the cold, so like getting them a warm blanket or trying to do anything to make their experience more better, and therefore like they'll be more willing to perform an exam. That helps too because certain patients they'll be in pain, but like if they see you helping them, and then let's say you go back to do another exam, they'll be like more friendly, more willing to do the exams. Some patients, I will say, that they will be mean, they will be in pain, they won't. They, you just have to go in there and try to be friendly and try to be nice, and because you can't. Some patients will be in pain and they will be saying the most amount of profanity, and you just got to be nice. Some people like I've seen several crazy things been going on in there, and then sometimes you'll have to take X-rays on little kids, which you'll learn in school. That's a different approach depending on how their age, and like you'll have to be like get down to their level, try to be nice with them, try to be friendly, try to get them to sit, and then sometimes you'll have like certain patients where their mom will be there, or parent or guardian, whoever, and you'll have to, maybe sit them out, like put them out outside, because certain positions, or if they see their kid in pain, they'll get very, not hostile, but more, as more like precautious, more, more like sensitive, because it's their kid. But sometimes you'll have to like adjust them and move them. You're like, yes, they'll be in pain for a little bit, but it's all in the hopes, to get that image and stuff like that. Which also you can, if you're alone and you have to do an exam, like you can bring in the parent and have them let up, and then weather stuff so they can hold them meanwhile you do the exam. And also, like when you go do portables, always bring your lead to put on while you're performing the exam. Stay 6 feet away, especially right now with all this COVID stuff. Your PPE, N95, because there's been several times where there's been patients that they've been questionable, to say the least. Because like they won't be COVID positive, but it's a shortness of breath. And right now with flu season, you're not trying to get sick, because that hurts you, prolongs your stuff. But if y'all want, I could. My next video. I'll go more in details of like how to go like patient, like if you go do portables, I'll go in depth in that. I can make one video of that, and then another one over like how to do pediatric patients, or what to expect when you go up to like something like the ICU, where the patient's like they're just like on a machine, just breathing, and they can't move, you can't do nothing. I'll probably make a video of that, because I remember the first time doing any of those, I didn't know what I mean, you learn like what to expect, but it's not until you're actually out there in the field that you actually see how it's done. Because some things you'll learn in school, like by the book, but then when you get out there, like it's a whole different thing. Like you have to do things way differently to be able to get that image, or to be able to adjust the patient, or be able to do like what you got to do. So always keep that in mind. Like always remember your knowledge from school. Like have it, like because you'll need it for the registry. Because like let me give you an example. So you'll learn in school to do like, let's say, a wide view shoulder. So you bring the arm up, move the patient against the buckboard, and then your X-ray beam will be behind you. So in some sites, to make it more easier, they'll do the same thing, but they'll shoot at AP. And then the central ray, they won't tell you, oh, it's at the coronary process, or it's at at the spot. They'll be like, oh, it's just mid shoulder. And then other exams too, they won't be going. You won't measure and like you learn in X-ray school to measure to get to T7. You do the little hand trick, and over there they're like, as long as it's right there, mid chest, like you'll get it. So you'll do like more efficient. Like you'll be able to get the image. It won't be precise, but you'll be able to get the stuff. So you're not. It's more like they'll do tricks and stuff to speed up the process, because some of them, like if you did it by the book, like it could take longer. In some places they have so much stuff to do. So as long as it's not on there, some of them don't even call me. As long as it's in there, they'll shoot it and then let's go. So you always got to be cautious about that. But it's fun though. Very fun experience. I love it.